Acupuncture used in the treatment of sports injury is a huge practice builder, especially when combined with TCM energetics. The safety sleeve becomes very useful in this arena, as often the practitioner is targeting specific muscles and needs to use longer needles. One of the leading forerunners of this field is Callison. I've worked with Matt over the years, and I must say he has contributed to the growth of acupuncture and sports medicine in a major way. Matt has a sports medicine acupuncture certification program, has authored a motor point index book, and has another book on sports medicine acupuncture soon to be published. Another expert in the field is Whitfield Reeves, author of the Acupuncture Handbook of Sports Injury and Pain. Both Matt and Whitfield have specific ideas on acupuncture needling techniques. Matt Callison prefers traditional, non-coated needles and medium to thicker gauge depending upon body type and pulse. Whitfield, on the other hand, prefers coated, thinner needles. I'll demonstrate needling with both types of needles to give you an idea of how useful the safety sleeve is in any situation. Using Matt Callison's technique now, I have a 20.25 32 gauge 75 millimeter or 3-inch non-coated needle ready to use. I'll show you how the safety sleeve enables you to maintain a clean feel around the shaft of the needle while using longer needles in the hip area. First, we're going to isolate the upper of the two gluteus medius motor points. The first motor point is found by locating the posterior superior iliac spine, then locating the lateral superior border of the greater trochanter. So I've done that here. The upper motor point is found the middle medium point of the upper third. So once you've found the point, and I've already pre-swabbed this point, I place the TeWa needle on the point. I've already removed the tab. I'm tapping in the needle, sliding the safety sleeve to the surface of the skin, removing the insertion tube, and now I can take that needle in and take it down to the various layers. Now if I don't find the de-chi sensation in that process, I could leave the sleeve on and I can remove and angle the point till I find that motor point release. So using the safety sleeve makes it really easy to use the 3-inch needle in the hip point. These hip releases and a lot of other specialty techniques from Matt Callison's sports medicine acupuncture courses have been an invaluable part of my practice for many years. The TeWa non-coated needle with the safety sleeve is the needle of choice for these techniques as they reflect the current best practice for risk reduction in patients, ease of use, and patient comfort. More recently, I have become familiar with Whitfield Reeves' technique for needling. Whitfield prefers thin, coated needles to release a muscle or acupuncture point. I have found that there are many opinions and techniques in the field, and it is important for you as a practitioner to try them out and see which one works for you. Whether you like coated or non-coated needles, the safety sleeve is available in both varieties. I'm now going to demonstrate needling the quadratus lumborum motor point using Whitfield Reeves technique with a coated .20 or 36 gauge 50 millimeter 2-inch needle. You locate the point by finding the lower border of the spinous process of L2. This is done by finding the height of the ilium, traveling across until you find lumbar 3. And then one little space up there I'll find L2, L3. Now 3 sun over, I should be able to palpate this area and find the tight bands of the quadratus lumborum. So now I take the TeWa needle on an angle and I slide the sleeve down to the surface of the skin. I tap in the needle, I remove the insertion tube, and now I can take the needle deeper till I find the point. I go in 2 inches till I find that point. Of course, we're aware that the lung may descend at this point, or the kidneys may be beneath, but angling the needle towards the spinous process makes it a safe insertion method. I'm going to show you that now without the safety sleeve. So I'm just going to tap in, find the L2, L3 point, I'll find the other side, the quadratus lumborum. I'm going to tap in the needle, remove the insertion tube, and now, as you can see, as I try to do that, the needle is bending and bowing, and I'm already wanting to get a cotton swab to stabilize the shaft of the needle. So, as a practitioner, using the safety sleeve is really convenient, and it helps you with your insertion process, helps you maintain a clean field around the shaft of the needle, and it makes it more efficient for you in the clinic.